to Dr. Grace Medical Show. I'm glad you're watching today. Today, let's talk about flu. Flu is a viral infection that is very common in cold climates. What are the symptoms of flu? Flu can give you symptoms such as headache, fever, body weakness, body pain. Your joint could be very aching, very tired, feeling so exhausted. You could be having runny nose, nasal congestion, and cough. Do you know that there are different types of flu? There is the seasonal flu, which is very common during the winter period. Usually it starts from the month of October to April, and the peak period is in February. And there are other types of flu, like the H1N1 flu virus, and that is the swine flu or the pandemic flu. The third type is the bird flu. And do you know one thing? That you could actually you can spread the virus to someone else, even without you having the symptoms, a day before you start developing the symptoms, and even 7 days after the symptoms have disappeared. But the peak period when you transfer the infection most is when you are running temperature. And do you know that the period of flu, which runs from October to April, you can actually come down with the flu. And the flu affects any age group. It can affect children less than 1 year old and can affect an elderly person. When do you need to seek help? Especially for your children. When you notice your child continuously have temperature, your child continuously have nasal congestion and it's getting worse. Your child refuses to drink any fluid or water and the temperature persists. Or your child starts pulling his hairs or her hairs. Or there is a discharge from the eyes. You need to quickly go and seek medical attention. How do you treat flu? Normally, flu virus, since we know it as a virus, it resolves on its own. Between the days of 10 and 14 days, the virus will resolve on its own. But if you seek help 48 hours when the symptoms begin, antiviral medication can be given to you, and that will help you. Other than that, there are other measures like you have to increase your fluid intake, increase your water intake, you have to take pain medications. There are pain medications like normal Tylenol, paracetamol, and the like Advil. It really helps you. What other things can you do? We tell you you have to give yourself adequate rest. What I mean, you need to rest. That is not the time for you to work out or to go to work. You need to give yourself adequate rest for your body to get back to action. And how do you prevent this flu? Flu can be prevented in many ways, but the most important way to prevent flu is by being vaccinated. Yes, what do I mean by being vaccinated? You have to take the flu shot. Usually it is very advisable for you to take your flu shot during fall season, before the flu season comes up. And that is why we say seasonal flu. It is seasonal flu because it happens during the season of cold, from October to April. Peak period at February. Now, if you have not been vaccinated for flu, go and get yourself vaccinated. It helps you. And you may ask me, why do I take the flu shot and yet I still come down with flu? Yes, there are reasons for it. One of them is this: the flu vaccine that you are given takes 2 weeks for the antibodies in your body to build up. That means for your body to build up agents. That means that will help you fight against the flu virus. If you have the flu before the 2 weeks of the effect, you can come down with flu. Another reason is this: the flu virus itself has something we call antigenic drift. They change their patterns, they mutate, they change their strains every now and then. So if you have vaccinated with a particular strain and you get infected with a different strain, you can come down with flu virus infection, and that means they did not match up. And scientists have been trying to make sure they improve the different strain of vaccine that are being produced every year, and that is why you take your vaccine also every year. The vaccine that you were given the other year may not be the same vaccine, the same pattern of vaccine that you take the other year. So it is, and another thing is this: when you are vaccinated, it prevents you from having the flu complications. So it is better for you to get vaccinated so that it helps you to fight and prevent you from having flu complications. What are other ways for you to prevent flu? Wash your hands. Give yourself adequate hand wash when you go out. Make use of hand sanitizers. And the moment you come down with flu or you come down with common cold, treat yourself immediately. Do not wait. And if there is anyone coughing, or you yourself are coughing or sneezing, try to cover your nose and your face. I hope this helped you, and if you have any question or any comments, don't forget to link me up, subscribe to this channel so you can follow me up. Drop your questions down below or meet me up in my blog. The link down to my blog is also written below. Thank you very much, and I see you next time. Goodbye.